And what are the advantages of having a combination medicine?
Well, the main advantages are really twofold. The first is that if you really need to take 2 or more medicines, they're only in one tablet or pill. And the other thing is, because they're combined like that, they're often somewhat cheaper, whether you buy them in the supermarket or over the counter or even get them on prescription. They still tend to be slightly cheaper than having the 2 or 3 separately.
And then what would you say are the disadvantages of a combination medicine?
Well, there are many potential disadvantages. The majority of them are actually combinations for the same condition, like pain or sinus problems or high blood pressure. But even though they're for the same thing, there can be problems. Say pain, there are numerous products for this in any supermarket. And one of the problems is they all have their trade name on them in very big letters, which doesn't necessarily tell you what the active ingredient is, which is usually a longer word and in smaller letters. So just to take an example, products called Panadol always contain paracetamol, which is a painkiller. But then there's a lot of other products that also contain paracetamol, and they're called something quite different. So if, for example, you have a pain in your back and you like taking paracetamol for it, and then you get a sinus infection and you buy a sinus product, almost certainly that will have paracetamol in it as well. But unless you look very, very carefully at the small print, you won't know it. And paracetamol, paracetamol, although it's a very safe painkiller if taken appropriately, if you take too many, it can damage the liver. So you can get side effects by unintentionally taking too many of them. There are other problems as well, in that if I still think about pain control, there's a lot of combinations of paracetamol with codeine. But about 10% of the population get no benefit at all from codeine. And unless you've actually taken it by itself to find out whether it works in you or not, you won't know. So you could well be one of the 10% of people wasting your money by buying a combination that just isn't going to work in you.
And are there other possible problems, such as if you needed to adjust the dose of one part of the medicine but not the other? Or?
Well, very much so. If we look at combinations that are available for say high blood pressure, they usually have 2 different things in them. Occasionally they might even have 3. But unless you've taken them separately beforehand, you really don't know which one is working, if they are working, or maybe one isn't working, and you don't know necessarily which one is giving you a side effect. So my recommendation would be, and a lot of doctors do this, but they don't always think about it. My recommendation would be is that if you need treatment for high blood pressure, you always take individual things first and work out which suits you, which controls your blood pressure, which ones don't give you side effects, and only then maybe ask your doctor if there is a combination of the 2 or 3 that really suit you, and then see if you can get that. And I actually think it is a big mistake ever to take a combination until you know how you respond, both in good ways of them working and bad ways of side effects. Until you know that, you shouldn't really be taking them together.
And would you have